If you want a project that instantly shows recruiters you can build real AI products that help real people, a virtual health assistant is one of the strongest choices you can add to your portfolio, especially if you are an AI, ML, CSE, or data science student preparing for internships or placements. This project lets you create an intelligent system that talks to patients, understands symptoms, gives basic guidance, schedules appointments, and reminds users about medicines. It uses natural language processing, so the assistant can understand everyday language and respond clearly. This matters a lot between 2025 and 2027 because healthcare systems are overloaded, and millions of people need fast access to medical information. Virtual assistants reduce pressure on hospitals and make healthcare more accessible. In real scenarios, these systems help with symptom triage, appointment booking, medication reminders, and patient follow-up support. You learn how conversational AI improves care, especially in remote areas. Companies in telemedicine, insurance, hospitals, pharmaceuticals, and healthcare startups hire students who can build such assistants because they want solutions that scale. A project like this proves you understand both AI and patient-focused design, which makes you a strong placement candidate. To build a virtual health assistant that feels reliable and recruiter-ready, you need a solid mix of NLP skills, technical foundations, and healthcare awareness, and this slide shows exactly what matters. You start by learning intent classification, which helps the system understand what a user wants, and entity recognition, which extracts symptoms, medicines, or conditions from their message. You also learn dialogue management, so the assistant can remember context and keep conversations smooth. Text pre-compassing and tokenization make the model understand language better, while sentiment analysis helps detect if a patient sounds worried or stressed. On the technical side, Python is your main language, and machine learning helps build intent models. You use SQL or NoSQL databases to store patient interactions safely. You also learn API integration to connect your assistant to hospital systems, and cloud deployment to make it accessible anywhere. Tools like RASA, Dialogflow, Spasic, NLTK, Hugging Face Transformers, LaneChain, and FastAPI help you build and scale the assistant faster. Soft skills matter too, such as understanding medical terminology, respecting data privacy, designing conversations that feel natural, and testing complex dialogue flows. Recruiters like these skills because they show you can build safe, structured, and human-friendly healthcare AI systems. When you build a virtual health assistant, you need a clear step-by-step roadmap so your project feels structured and professional, and this slide lays out a practical workflow that matches how real conversational AI teams operate. But, you begin by defining your use cases, such as symptom checking, appointment booking, or medication reminders, and you map out user personas so the assistant speaks in a tone patients trust. You also set boundaries for medical information and decide when the system should escalate to a human professional. Next, you collect data from medical FAQs, symptom lists, and conversation templates, and you train intent models and entity extractors for symptoms, medicines, and body parts. After this, you build the chatbot logic using frameworks like RASA or Dialogflow and integrate NLP models to understand inputs clearly. You design conversation flows with proper context handling and add multilingual support if needed. The final stage is integration and testing, where you connect the assistant to scheduling systems, secure databases, and deploy it on web, mobile, or messaging platforms. You also test it with different user scenarios and apply security measures to protect patient information. Beginners usually need 8 to 10 weeks, while intermediate learners can finish in 4 to 6. Following this roadmap shows recruiters that you can build a real end-to-end healthcare chatbot. This project opens strong placement pathways because conversational AI in healthcare is growing fast, and companies need engineers who can design safe, accurate, and scalable virtual assistants. When you complete this project, you become eligible for roles like Conversational AI Engineer, Healthcare NLP Specialist, or Chatbot Developer, and these roles focus on building systems that understand medical questions, identify symptoms, manage dialogue states, and guide patients through their next steps. Recruiters look for candidates who can handle complex conversational logic, manage context across multiple turns, and follow healthcare workflows with proper privacy controls. They also expect familiarity with NLP frameworks, chatbot platforms, and production deployment. Your resume becomes stronger with keywords like conversational AI, intent classification, healthcare automation, and medical entity extraction. Companies such as Babylon Health, Ada Health, Boy Health, HealthTap, and multiple telemedicine platforms hire developers with these skills. Salaries are competitive, with freshers earning around 7 to 14 lakhs in India, and those with 2 to 3 years of experience earning 16 to 28 lakhs. In the US, entry-level roles often start near $80,000 and can go much higher. This project proves you can build meaningful AI that supports patients and healthcare teams. Start building this today and put it on GitHub.